Child CPR. For purposes of child CPR, a child is anyone from 1 year of age to puberty. If you are unsure of a child's age, treat them as an adult. Cardiac arrest in children often results from breathing problems, but it can also be caused by drowning, choking, poisoning, severe injury, and other problems that cause them to stop breathing first. While giving CPR to a child, it is recommended to perform both compressions and breaths. Child CPR is similar to adult CPR, however, there are a few differences. Compress the chest approximately 2 inches. You can use 1 or 2 hands to give compressions, whichever is necessary for you to push the chest deep enough. If you are alone with a child or infant and don't have a phone, start CPR immediately. Perform 2 minutes of 30 compressions, followed by 2 breaths 5 times before leaving the child to call 911 and get the AED if available. Return to the victim quickly as possible. To perform CPR on a child, check scene safety. Establish unresponsiveness by gently tapping and shouting, "Are you okay?"
Hey, are you okay?
If unresponsive, send someone to call 911 and get an AED. If you are alone, perform 2 minutes of compressions and breaths before leaving the child. Check for breathing. Observe for breathing or gasping. Check for 5 to 10 seconds. If the child is not breathing, start CPR. Bare the child's chest. Place 1 or 2 hands on the lower half of the breastbone center of the chest. Start compressions. Compress the chest approximately 2 inches at a rate of 100 to 120 compressions per minute. Compress 30 times, making sure your compressions are fast, hard, and deep. After 30 compressions, open the airway by using the head tilt chin lift method. Then, give 2 breaths. Place a mask barrier over the child's mouth with the airway completely open. Give 2 breaths, 1 second each. Make sure you have a tight seal so no air escapes from the sides. While giving breaths, look towards the chest to see if the chest rises. Continue to perform 30 compressions, followed by 2 breaths until EMS arrives, an AED arrives, or the victim shows signs of life. Once the AED arrives, immediately place it into operation.